Hi, my name is Dr. Maqsood. I'm a consultant respiratory physician here at Midland Health. So pneumonia can be of mild intensity and can be of very severe intensity and occasionally life-threatening, especially in elderly and in immunocompromised individuals. So there are certain symptoms you shouldn't ignore, especially if there's more than one. So that can include having high chills and fevers, if somebody's getting confused or they're having their loss of orientation. Then somebody's getting extremely debilitated or lethargic or dizzy. And then if there is cough with purulent discolored phlegm or somebody's coughing up blood, moving further, if they're having chest pain every time they breathe or cough, and if they feel they're getting dehydrated, not able to eat or drink, and especially if they're getting breathless or having chest tightness and wheeze, then these are all the symptoms which are alarming, and if more than one, then they might need hospitalization and intensified treatment. So usually cough, which is acute in nature, can be associated with a viral illness, but if it goes beyond 3 weeks, then it can be something more than that. It would be worth getting a checkup, especially if this is associated with any chest pain every time you breathe or you cough. And if there is having a purulent or discolored phlegm or somebody's coughing up blood with that, that's for more serious nature probably. Then if someone is getting more breathless with coughing, getting chest tightness or wheezing, that can be indicative of any underlying lung disease. And if there is a history of fever, weight loss, or night sweats, that might be indicative of some ongoing infection, which may need further investigations. First things is you should have a good diet and exercise. Good diet to include the whole grains and plenty of fruits, vegetables, having plenty of hydration. Make sure you're getting good vitamin C, vitamin D, and zinc. That helps with your immune system as well. Then avoidance of any irritants such as pollutants, such as tobacco, and then avoidance of any allergens if you have. And then going on further is maintaining a good degree of exercise, modest degree of exercise. That's very helpful to maintain the lung health. And if somebody's got their already known lung condition, like taking their inhalers, especially if going out in winter or doing some sports activity, that might be very helpful. Colder months can lead to worsening of the breathing symptoms because cold air can precipitate bronchoconstriction, which is narrowing of the airways. And then the cold air can also lead to further inflammation in the areas, which can lead to further narrowing, leading to chest tightness and bronchoconstriction. It can also make someone prone to getting infections. So the things which should be done to help keeping these symptoms away is the most important thing is having all the appropriate vaccinations, such as influenza vaccination, or the persons with having underlying lung conditions should be getting pneumococcal and Haemophilus influenza vaccination. There's a new vaccination called RSV, which should be considered as well in certain individuals. During the colder months, make sure your diet is good. You're taking a good diet, including probably vitamin D supplements, because sunlight is not enough in the winter hours. And then additional supplements might be required to help the immune system is working well. It would be helpful to cover yourself before going out in colder air, and then maintaining good hydration so your mucous membranes are protected as well, and avoidance of any allergens such as tobacco. That will be helpful as well to maintain good respiratory health during the winter. If you have any of those symptoms or you would like to know further about your lung health, so you can book an appointment with us at the website, and we'll be pleased to help you and see you in the clinic.